Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then she will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I would like to recognize the team who prepared the opioid dashboard and to comment on the most recent data released today. Between July and October alone, 449 Albertans died from apparent unintentional opioid poisoning. My heart goes out to all who have lost a loved one. It is a sad reminder that while COVID-19 is a serious and deadly pandemic, it is not the only public health crisis impacting our families and communities. I ask Albertans to show compassion and support to those dealing with substance use issues, their family and friends, and to all those grieving the loss of a loved one. These are difficult times for many. With respect to COVID-19, over the last 24 hours, we have identified 1,413 new cases in Alberta and completed about 19,500 tests. This means our positivity rate stands at about 7.4%. There are currently 759 people in hospital, including 141 who have been admitted to the ICU. Sadly, 25 new deaths have been reported to us in the last 24 hours. My thoughts are with everyone mourning a loved one right now from any cause. I know the current restrictions impact how you can grieve, and I urge you to seek support in whatever ways are available to you. COVID-19 impacts us all. There are currently active alerts or outbreaks in 443 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,971 cases. I know this has been yet another tough week for many Albertans, a difficult week in a difficult year. However, we are starting to see some early positive signs in our province. On Tuesday of this week, there were 1,286 new cases of COVID-19 identified. That was the lowest daily total since November 26th. As of today, there are 19,607 active cases in the province. That is the lowest it has been since December 5th, 2 weeks ago. Our provincial positivity rate fluctuates on any given day, but is on a downward trend from the high of 10.97% on December 3rd. Now I want to be clear, our fight is far from over. We expect that hospitalizations and ICU admissions will continue to rise in the coming weeks, as these are lagging indicators, meaning that it takes several weeks before changes in our case counts are seen in the demands felt in our acute care system. Our health system continues to feel the strain, which will increase in the days ahead. But what these numbers show us is that together, we have the power to protect our communities and to change our future. We must continue to do everything possible to protect the care system that we all rely on. I know that a great many healthcare workers are working incredibly hard these days and will be working all through the holidays. I am grateful to all of them and to all frontline workers. It is for them that we must maintain our progress. In the past, we have seen COVID-19 cases level or dip before, only to rise again. The positive indicators we are seeing can be reversed in a matter of days if we all don't keep doing our part. It is up to us to continue this momentum. With the weekend upon us, I'm asking all Albertans to remain vigilant in following the restrictions in place. I know many people are still busy preparing for the holidays and shopping for groceries and gifts, but we all need to do so in the safest manner possible. Do not try to crowd into malls or stores. If you're able to, take advantage of curbside pickup or online telephone ordering. If you must go shopping in person, only go shopping with those in your household and try to go at a less busy time. While you're out, be sure to maintain physical distance from others And if you arrive at a store or mall and see it's crowded, leave and try again later or make other arrangements. As always, I am asking Albertans to abide by not only the rules in place, but to embrace the spirit of them. We need to reduce in-person interactions as much as possible. Anything you can do or not do this weekend that helps limit your exposure, please take that step. Bend the curve, not the rules. The positive signs that we are seeing show us the power of our collective action. If each of us follows the restrictions in place, we can keep reducing the spread, but the reverse of that is true too. If we let our guard down or gather together in the next few days, we will see cases rise. Thank you to everyone doing your part to make sure that this does not happen. This has been another hard week, but there are a lot of reasons for hope. Let's all keep working together and protecting each other. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Our first question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. You noted some positive signs earlier. The second chunk of restrictions came into effect last weekend. Is there any indication yet of what type of impact they have had, if any?
We did put into place a couple of province-wide measures on Tuesday of last week. So it's possible that some of those measures, such as our province-wide masking mandate, have started to take effect in the last few days. With respect to the measures that went into place on Saturday, or Saturday night over to Sunday morning, I would say that we know that we encouraged people to start following those measures as soon as they could, to see Saturday night as a deadline, not as a starting place. And so it's hard to say exactly how much impact we're seeing of perhaps some of those early decisions people were making to modify their behavior. The full impact of the measures from last Sunday, we will not see for another few weeks, but I would say that by the middle of next week, we should start to see those early impacts of the changes that were made. And layered on top of the plateau that we're currently seeing, those two together will absolutely, if we all embrace them, have a positive effect on our cases, and we'll be able to bring those numbers down.
Operator, could you put through the next question, please?
Our next question comes from Rafi Boudjikanian of CBC. Your line is open.
Thank you. Hi, Dr. Hinshaw. Just looking at the hockey bubble cases in the World Juniors bubble, I understand that the 10 people who caught the virus appear to have done so before they got to Canada. But since March, you have been telling Albertans to stay home if they're sick. Just recently, you've said everyone has to work from home unless they really can't. How concerned are you about the mixed messaging this might be sending out, as a hockey tournament can take place while you're telling the rest of us to drastically alter our lives?
As you say, the positive tests that have been identified at the World Junior or within the groups are the result of the very strict protocols that are in place for regular testing and quarantining before the groups start to come together to play. So those tests are a result of the system working, identifying those who are positive, making sure that they do not have the opportunity to spread to any others, and making sure that the bubble is maintained. And so once people have gone through that quarantine period, have had those tests, making sure that they're not potentially going to introduce the virus, only then starting that activity. I absolutely recognize that there are many in Alberta right now who would love to play hockey, who would love to play a team sport or do another activity that currently is not permitted under the current restrictions. What I looked at when I was asked to consider whether or not the tournament should go ahead, the World Junior Hockey Championship, primarily my job is to protect public health, and I wanted to make sure that the protocols that were in place were rigorous and would not cause any risk to the public, and I'm confident that that is the case. When then considering again the challenge of allowing or not the tournament to go ahead, That was a judgment call because I know that many people also get joy from watching these kinds of events. And so once satisfied that that would not cause harm to the public, I did make the decision to allow it to go ahead for the purposes, again, of providing some entertainment to those who are unfortunately not able to engage in those sports at this time. But what I will say is the measures that are in place are again, starting to have that early positive effect. And the more that we can all work together to bend the curve down, the more likely it will be that we can start to ease these restrictions in January when we hope to do so. So our best chance of all getting back to those activities that we love, likely with still some measures in place, our best chance of doing that is to keep on with the actions that restrict the spread of the virus so that we can all enjoy those activities in a safe way when the time comes to assess the measures again.
Operator, could you put through the next caller, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. A question about the opioid numbers. Why do you think the numbers are at such a high level? And the Premier and others have singled out CERB payments and other benefits for fueling addiction and prompting some to spend their money on drugs. What evidence does the province have that this is what's driving these numbers?
I think it's difficult to know exactly what all the causes are of the increase. We know that when we went through our spring restrictions and we closed down access to multiple services, that there was a question about whether or not some of those restrictions could have possibly exacerbated or made it harder for people who needed help to get it. We have been very intentional in our most recent round of restrictions to ensure that access to the full spectrum of services that individuals who are experiencing substance use issues need, that we are not restricting those activities or services. But it is very challenging to know exactly what all of the causes are. As you know, we did see a high number of deaths in July, and then it has come down somewhat from then, although of course every death lost is a tragedy and preventable. And so we continue again to watch this data to try to learn what we can from it and to provide that full spectrum of services to those who need them.
Operator, could you put through the next question, please?
The next question comes from Jason Herring of Post Media. Your line is open.
Good afternoon. Among today's 25 deaths is a woman in her 20s from the Calgary zone. And according to Alberta Health, she did not have any comorbidities. This is the third death of a person in their 20s in Alberta from COVID-19. I'm wondering what message you would have for younger Albertans about the risks of this disease.
This is a tragic reminder of what we have been saying, which is that while the risk is lower for individuals who are younger, it is not zero. And it is unfortunately, again, an example of how we can lose people to COVID-19 of all ages. So, I think what I would say to people who are in their 20s and 30s is that it is critical to be thinking about your actions, about all of our actions, not just for yourself. This is an example of how, for some people, unfortunately, catching the virus that leads to COVID-19 can lead to severe outcomes, but of course, the people around you. And so if somebody who has COVID-19 and has a mild illness spreads it to others of whatever age, again, this is just a reminder that there can be these tragic consequences. So please, this again is a request to all Albertans, is that we need to follow these measures every day because we don't know who might get the virus next week, who might be susceptible to it. And the actions we take this week help all of us to be a part of the solution, not a part of the problem.
All right, there's 3 left in the queue, so we'll take our final 3. Operator, could you put through the next one, please?
Our next question comes from Jesse Weisner of Global News. Your line is open.
Oh, hi, Dr. Hinshaw. The Calgary Airport Authority is expecting 10,000 travelers this holiday season, and while that's down from 50,000 last year, it's still quite a few people. What's your reaction to those numbers and your message to travelers?
When we implemented the restrictions on indoor social gatherings, we did talk about the fact that if someone had a family member who was a permanent resident of Alberta, or Alberta was their regular place of residence, even if they, for example, were going to post-secondary or going somewhere else, that they would be able to come home. But of course, for anyone else who's coming, my message would be that it's really critical that if you're coming from another province to Alberta at this time, that you follow the rules the same as anyone else in this province. And again, as I've just said, we all need to be a part of the solution, not a part of the problem, which includes no social gatherings, which includes making sure that our actions do not put others at risk.
Operator, could you put through the next question, please?
Our next question comes from Dylan Short of the Edmonton Journal. Your line is open.
Hi, Dr. Hinshaw. It's been a couple weeks now since you introduced the ban on indoor social gatherings. We know that that was a huge driver. I was wondering, does Alberta Health have data on how well people have been following this particular restriction? And as we come into the Christmas week, I guess, starting on Monday, how confident are you that Albertans will continue to follow these restrictions in what is, for a lot of people, probably the toughest week to do so?
The data are difficult. So in terms of understanding how many Albertans are regularly following all of the restrictions, that's difficult to know. I have heard polling data that indicates that almost 80% of Albertans support the measures that are currently in place and believe that they are the right steps to contain the virus. But of course, the restriction on social gatherings is a difficult one. And of course, as we're heading into the week of holidays next week, that for many people is the time when they gather with family and friends, it is a difficult restriction to follow, I know. However, the fact is that we know, it's very clear, that when people gather together in an indoor setting, sharing food and drink and in close contact with each other, that kind of setting is exactly the setting where COVID-19 spreads quickly and easily. And we also know that the time lag between Thanksgiving and an uptick in our cases was about that 1 to 2 week time period, which we know again is sort of that average incubation time period from exposure to disease. And we only had roughly between 200 and 300, it was a little more than 200 new cases a day before Thanksgiving. So just imagine the same kind of accelerating factor going into Christmas with, today over 1,400 new cases. So even though this is a plateau, our new case numbers are extremely high. And if Christmas were to serve as an accelerating factor with this current new case level, we could easily be well beyond 2,000 new cases a day within a few weeks after Christmas. So I'm asking all Albertans, stay the course. We need to make good decisions for each other, for our communities, for our families and our loved ones, and for ourselves. While it's difficult, it is necessary right now. And I, again, just want to reiterate that we are in this together and we need each other to do the right thing.
Operator, could you put through the final question, please?
Our final question is from Brenna Rose of CTV. Your line is open.
Hi, Dr. Hinshaw. Summer events came up last night on the Facebook Live with Premier Kenney. Is there some kind of metric that will be used to determine if spring and summer events can happen? Previously, the R value has been referenced. Is that the metric that will be used?
The R value tells us what spread has been like in the past. We usually use the past week. And so the R value tells us about our history. It doesn't tell us about our future. And it also has to be looked at in conjunction with the number of new cases every day, as well as our positivity rate. So we don't have any single metric alone that's going to be the predictor of what we're going to be able to do in the summer. I think that with our current anticipated vaccination program, and that of course depends on the number of doses that actually become available at the times that we expect them. And with the things that we currently know about COVID-19, we do know that our public health measures that we had in place last summer were less stringent than what we have right now, and yet were sufficient to hold the line on transmission. So again, making a decision in February, I think what we're going to be looking at, we'll know more, hopefully by then, about vaccine supply, about projected dose numbers, and who will be able to vaccinate. And we will have a sense at that point of the trajectory in the province. And again, our best hope of having the ability to do more over the coming months is to get our case numbers down now, because if we enter into January with high case numbers, our restrictions will last for longer. And if we hit February again with very high case numbers, even with vaccine, it takes longer to bring the case numbers down. So there's, again, no single metric. We'll be looking at trends. We'll be looking at our vaccination doses that we're expecting, and we'll be looking at the kinds of protocols that may be required to start thinking about what types of events might be possible next summer.
Thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.